Hello, professionals. This is Dr. Saad, and as you know, we are recording series of lecture for pharmacists who are going to appear for international equivalency exam. As we are talking about endocrine system, and under this subtopic is diabetes mellitus. So today's recording will conclude this topic, and let's resume our points. So from remaining points, today's point number one is about the symptom of diabetes mellitus. And point here is that excessive thirst is the first symptom of diabetes mellitus, as we have already discussed about the polyphagia, polydipsia, polyuria. So, but here point is the excessive thirst is the first symptom of diabetes mellitus. Point number two is an introduction of Lilly's insulin that is known as iletin 1 and iletin 2. It's a comparison of these two insulin, and the point here is that iletin 2 is more purified than that of iletin 1. As long as iletin 1 is concerned, its source of derivation is beef and pork, as it's a mixture of these sources because it contains 70% from, or it is derived 70% from beef and 30% from pork. And its purity factor is less than or equivalent to 20 parts per million per insulin. So iletin 2 is more purified than that of iletin 1, and iletin 2 source of extraction is either from the beef or from the pork. So this was just an introduction of Lilly's iletin insulins and its types. Point number three is about the continuous insulin syringe. It's just for the information that the insulin syringe are available in zero point 0.5 ml or 1 ml, which is equivalent to the zero point 0.5 ml syringe would facilitate or provide the room for administration of 50 units dose, and 1 ml will provide the opportunity for patients or facilitate patient to administer 100 units dose. So small inside diameter and capacity of zero point 0.5 caliber 1 unit. The main point is that by the use of these continuous insulin syringe, it's make possible for patient to measure small amount more accurately because of its small calibers and easy to measure. So this was just for the information that continuous insulin syringe is one of the source of administration of insulin through which a patient can easily measure it. Point number four is about the glucose, about a comparison and interaction with the interaction of glucose monitoring test, as we have two types of method for quantitative measurement of glucose. Number one is the glucose oxidation test, that is also known as the test tape method, and the second is the copper reduction method. It is also known as the Clini test. The point here is that the copper reduction method are more quantitatively measure of glucose than that of oxidase test, or you can say that Clini test measures more accurate quantitatively glucose as compared to test tape. But here another problem which happens with this copper reduction test, that if a person is user of cephalosporin, then there is a false positive result expectation because cephalosporin level interacts with this measurement of blood, quantitative measurement of blood glucose. So our glucose level either from the urine or either from the blood. So here was also a case study that a patient who was diabetic, he was prescribed with cephalosporin 500 mg 3 times per day for the urine tract infection, and later on its sample of blood glucose, sample of glucose is being analyzed through the test tape method or through the clinic test. The results shows that test tape method shows 0.25% of glucose, and on the other hand, in the same from the same sample, clinic test shows 1% results. So it's so cephalosporin interacts with the copper reduction method, or you can say clinic test, and there is a possibility of false positive results with this test, especially those person who are cephalosporin users. Point number five is about this was all about point number four, and point number five is about the sliding scale method. As I told you that the determination of 24-hour insulin requirement of a ketonic diabetic patient, this method is used, and for according to patient's blood glucose level, regular insulin, or we can is preferred, or its dose is modified. For that we use specifically clinic test, or also known as copper reduction test through, or we can say we use copper reduction, or you can say clinical test for the number of units for each or more available schedules. So according to patients sliding scale method monitoring for the blood glucose level, insulin dose is adjusted. So it is recommended that to use regular insulin within the combination of long-acting insulin through subcutaneous routes for the administration and management of patient for normal glucose level. So this was just about the sliding scale method and its introduction. Point number 6 is about the purity of insulin, as it's a repetition of previous point. It says that currently available all insulin contain no more than 25 parts per million of proinsulin, which is a purity factor of insulin. Point number 7 is about the glucose tolerance curve. If you draw a glucose tolerance curve, it shows that high peak uh, in the beginning, high peak appear laterally after a long time, and decline more slowly than as compared to as corresponding blood glucose level curve of a normal individual. Simple is just that the glucose tolerance test curve shows that the blood glucose peak arrives late, but it declines more slower than that of normal patient because in diabetic patient definitely blood glucose level remains high. So that's what's all about the glucose tolerance curve. Point number 8 is about the causes of diabetic ketoacidosis. As I have already talked about the causes in previous videos, but here I would like to add another point. As we was talking about the causes of diabetic ketoacidosis, I was telling you that as we have already talked about its causes in previous video, but I would like to add one more point here, that error in insulin dosage in response to food and physical activity change is one of the most important cause of diabetic ketoacidosis. And side by side, other causes are infection and myocardial infarction. But in response to physical activity, dose change must be measured correctly. That's why sliding scale method is being designed, through which we can use proper administration of insulin. So this is to avoid from the diabetic ketoacidosis complications. Point number 9 is about the insulin glargine action. As you know, the insulin action is to increase the glucose uptake and increase the glucose utilization by the tissue. So it was just for information. As you know that when you have the option of oral antidiabetic drugs, similarly insulin. So which option would effectively control the blood glucose level? Definitely insulin will control very effectively blood glucose level, because it's a fast and effectively its route of administration is subcutaneous. That's why it doesn't go through the first pass effect and other barriers. Point number 10 is about the metformin side effect. Lactoacidosis is one of its side effect, and it happens due to the inhibition of gluconeogenesis. Point number 11 is about the diabetes. As you know that risk factor for cardiovascular disease, when you see the list of risk factor for cardiovascular disease, then diabetes is one of most important risk factors. Point number 12 is about the diabetic foot causative agent and dressings. As long as the diabetic foot causative agents are concerned, gram-positive bacteria like S. coccus and Streptococcus aureus and beta hemolytic streptococci are among the causes of diabetic foot ulcer. But and as long as its dressings are concerned, simple gauze damage the skin. That's why dressing impregnated with the antimicrobial agents and alginate and foam dressing impregnated with antimicrobial agents are preferred as compared to the simple dressing, because it doesn't damage the skin. Similarly, alginate and foam dressing provide high absorption for moderate to high exudate, and hydrogel or dressing with collagen and silver are most effective. So these are both the dressings and causative agent of diabetic ketoacidosis. And so we don't use simple dressing, and we will prefer to use alginate or foam dressing or hydrogel or dressing with collagen or silver to treat the situation effectively. Point number 13 is about the carbose maximum dose. About the dose of a carbose maximum dose. About the dose of a carbose. As you know that a carbose maximum dose is 600 mg per day. It was just an introduction. So point number 14 is about the normal fasting blood glucose level I'm sure you are well acquainted of that, but I just want to give you here any unit of conversion. Like sometimes question can be asked through in mg per deciliter, or sometimes it is asked in the form of millimole per liter. So I would like to give you a standard. Like just keep in your mind that 3.9 millimole per liter is equivalent to the 70 milligram per deciliter. And 3.9 is equivalent to 70 mm per deciliter. So when question is asked, you can easily convert according to the question through the unitary method. Just keep once again in your mind that 3.9 millimole is equivalent to the 70 milligram per deciliter of deciliter. This is a standard through which you can easily calculate the fasting fed and postprandial or diabetic pre-diabetic insulin. So this is just keep in your mind. But normal, as for you, just for your information, that normal fasting blood glucose level is between 3 to 6 millimole per deciliter. Point number 15 is about the insulin overdose symptom. As I told you, when insulin is administered mistakenly in a higher dose, then patient can show following symptom, that is the anxiety, confusion, extreme hunger, fatigue, and irritability, sweating, and trembling of hands. These are some of the symptoms which is visible when mistakenly insulin is administered in a higher dose. Point number 16, that is the last point, is about the interaction of aspirin with the tolbutamide. As you know that aspirin increases the hypoglycemic effect of tolbutamide by displacing from plasma proteins. So aspirin dose. So this was the interaction that aspirin displace. So aspirin increases the hypoglycemic effect of tolbutamine by displacing it from the plasma protein, because a free drug will be available. So there's chances of hypoglycemia. Similarly, aspirin decrease the uricosuric effect of probenecid. These are the two interaction. As the first one interaction with the tolbutamine is directly linked with our topic, that's why I mentioned here. And second interaction with the probenecid is just for information, that aspirin also decrease the uricosuric effect of probenecid. When we'll talk about the interaction and we will see about hepatic metabolism of drug, there we will discuss these all drugs, their examples in detail, that how drugs are affecting other drug. Sometimes it increases its action and sometimes it decreases its action. So here our topic of diabetic mellitus is end. This was the last point of our topic. No, we will go and see the clinical aspect of endocrine system, in which we will talk about some diseases, and we will see how group of drug is being used to treat various conditions. For example, these conditions are thyroid and parathyroid disease, or diabetes mellitus, and menstrual cycle disorder, menopause, and rheumatoid arthritis and osteoarthritis. These are some of the main diseases which we will see how we are implicating pharmacological classes for its management, and what guidelines says us to use these classes in which regime to manage the situation. So uh, thank you so much for listening, and if you feel that my this effort is helpful for you, then please subscribe my channel. See you in next video.